Clear.
Yeah, it is clearly audible, sir.
Okay.
I think some problem might be in your mobile.
Maybe
Yeah,
maybe
it's very
real
clear.
bandwidth.
Audio is very clear.
Yeah, it is clear.
Audio is very clear. Sir, you can go ahead. Audio is clear.
Okay.
Yes,
Okay. Okay, sir. Okay. Okay. Thank you. The thing is,
Mr. BRV, your audio is clear, but we can't listen the speaker's audio.
Speaker's audio is also very clear with my phone. I am recording.
Yeah, speaker's audio is very clear. Even many of the people have put in the chat also. Speaker's audio is perfect.
shall I continue, madam?
Yes, yes, please continue, sir.
Okay. 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 Thank you. And in addition to that, in the case of body suit or the biosuit is concerned, we require a biocompatibility, certain types of biocompatibility tests also required, like irritation as well as since the thing is, if a person is taking the swab from a patient or for the sampling, he may require to wear 6 to 8 hours continuously also. Similarly, the medical professionals also, when he enters in the hospitals or typical COVID wards, they may require to wear it continuously. So it requires a lot of biocompatibility tests also, it should qualify it actually. So the material technology is very relevant, and DRDO and other some of the CSIR laboratories developed varieties of biosuits with the varieties of materials. Similarly, mask, disposable, reusable, different varieties of masks were productionized in our country. Earlier, many of these masks we were importing it. Due to COVID, actually the Tirupur as well as that Coimbatore belt, it was extremely busy for manufacturing. Day and night they are manufacturing it. Now they are exporting also. So in the last year, we ourselves developed certain technologies for the emergency purpose, and we have distributed all over the DRDO lab and some of the state government hospitals also. Next thing is the positive pressure protective garment. It is mainly for the doctors and medicos actually. And this is mainly used, actually they can use this thing when they will be inside the COVID ward. These particular items were developed for the under the biothreat mitigation program of DRDO to combat against biological warfare agents. These also considered are very close to biological warfare agents. So we thought this particular item can be modified and use it for the COVID-19 purpose. We have productionized more than 2,000 numbers, and it is used by the army hospitals in the borderlines actually. And this is the basic thing is there will be a positive pressure always generated inside the suit, so that there is no hot and humid system will not be, environment will be felt by the wearer actually. And this is very cost effective also. Even doctors are very comfortable when they are in the ICU also, and it can be reusable after the suitable disinfection procedure. And we have now, earlier there was a limited production, now a lot of orders are come, and this was even there are more than 6 patents are also there, and now there are a lot of manufacturing processes going on for this item. Then the patient transport chamber. Suppose if a person is transported from one place to another place and he requires full-blooded air supply, that otherwise the hot and humid will kill the person. So for that thing, a patient transport chamber was developed, and it is also once again maintaining the positive pressure. To continuously the air is flushed in so that no accumulation of carbon dioxide will be there, and person will be safely put it in the ambulance also, and it can be transported. And this particular thing is already introduced in the army service. Even for the COVID-19 in the borderline, this system is used. Next is the isolation tent. This isolation tent also under the biothreat mitigation program of DRDO, it was made actually. It is within 10 minutes we can generate this type of tent, and it is a negative pressure, so that if a person is inside, it is a 10-bedded isolation tent, and 10 beds we can put it inside, means 10 patients will be there. And if they generate the COVID-19 virus or any microbial contamination in the air, it will be taken away and passed through a system that will be decontaminated actually. So that also we have successfully developed. Already we have recently got around 5 numbers also, and we will be using it in and around Bangalore. It is very cost effective comparing to the imported one. It is the cost is concerned more less than 20% of the imported cost and meeting all the international norms. Then I will come to the medical management. Medical management is concerned. First thing I will tell ventilator, since everybody remembers ventilator on these days. And you know, our Bell has manufactured more than 30,000 ventilators. The technology was originated from SPMT, that is Society for Biomedical Technology, with the help of an academic institute called PSG Institute of Technology, Coimbatore. And we have developed the technology and we have transferred the technology also. And it happened 12 years back. Actually, this SPMT was started by Dr. Kalam with the intention that all the defense spin-off can be used to develop the useful technology to help the mankind. So under this scheme, this particular product was developed, and last year there was some critical component shortage was there since due to COVID. All the flights, everything was there was an absolute shortage of certain critical components. Because of its basic knowledge with 10 years back accumulated, we could develop all the components and we have given the technology to the BEL, which helped the BEL to manufacture 30,000. Most of the hospitals in and around Bangalore as well as in the country is using the CV200 ICU ventilator manufactured by BEL. Next thing is the PSA technology. Even in the invitation also you are seeing it, actually the medical oxygen plant actually. So that plant, actually the technology is basically from the PSA technology, that is nothing but the pressure swing adsorption technology. Here the pressure is a determining factor to adsorb or desorb a certain molecules. We are using zeolites as a molecular base, as a base, and that will be absorbing certain molecule at a certain pressure. In this case, actually, we are using lithium-based zeolite crystals, or it is a zeolite pellets, and that pellets has got a tendency at a particular pressure, it absorbs or it holds only nitrogen, and oxygen will be passed through. Similarly, if you put the two parallel system, both the time it will simultaneously work, actually means one will be doing the absorption and other will be doing the desorption. Like that, actually you can continuously generate oxygen. This is the concept we have used for our onboard oxygen generation system for the light combat aircraft. When this requirement was felt, so it was advised at least a year back that why don't you use this technology for the medical grade oxygen generation. Actually, even in the case of light combat aircraft also, whatever oxygen generated is also for the breathable purpose. So we have done certain tests as well as the medical oxygen grade, means there are certain requirements as per the WHO, and we have met all the requirement. Then we thought we can use this particular technology to develop the medical oxygen plant. And last year itself, in the first COVID time itself, we have made the first medical oxygen plant, and at that time the high altitude, that oxygen requirement was not this much was felt at like what we are feeling it now. So however, in the high altitude it was very much felt. So we have established our facility in the high altitudes. The first oxygen plant was kept in the Tawang, and it was installed, and right now it is working condition. It's not even for the last 1 year it is in the working condition, and it has got a facility to fill the oxygen cylinders also for up to 150 bar pressure. And this particular cylinder can cater for 20%. Here the oxygen concentration is 93 plus or minus 3% as per the WHO requirement. A similar facility we have established in the other places also. Tawang also we have established the same facility, and it worked 24/7, and it requires a minimum energy consumption. And at present in my laboratory also having a facility, medical oxygen plant facility in a mini scale, and we are supplying oxygen to various local hospitals like CV Raman Isolation Hospital and we are DRDO itself has started a small COVID-19 20-bed hospital by converting one of our guest house actually. There also all our oxygen cylinders are used. That oxygen is generated from this type of plant, which is there in Bangalore itself, that is in my laboratory itself. And similarly, DRDO population is around 20,000, including the extended family. All their oxygen requirement is met by this plant which is established in our lab. Next is the transport ventilator. That is nothing but a resuscitator. We have developed this particular system for the NBCD, that is nuclear, biological and chemical warfare program. We felt this thing can be converted to suit the COVID-19 purpose, and it is nothing but it is a automated breathing system. It is a non-invasive automated breathing system, and you can see in from the slide it has got a filter. It filters all the not only dust, even the biological warfare agents also, including COVID-19, can be filtered. And it is electronic system, and it can control it also based on that, but breath per minute volume and pressure relief valve is there, and all the safety alarms and battery charge indicators are there as per the requirements. And the weight is 6.5 kg. We have already tested this particular unit at the St. John's Medical College as well as the Command Hospital. And this thing further, we are transferred the technology to ITI, and they are ready for the manufacture of this particular thing. It can be used as a transport ventilator in the ambulance or in the house also during emergencies. Next is the lightweight portable oxygen concentrator. This thing it is under development. Here also the principle is under the PSA technology only, since we are already expertise this PSA technologies for the light combat aircraft. So this product is under development. Now the emergency oxygen supply to the house, this thing, it is based on the need. It's basically electronic system based on your SpO2 levels and other requirements. You can prefix it actually flow rate also. Normally it is fixed at the 2 liters, 2 LPM, 5 LPM and 10 LPM, depends upon the requirement and as per the advice of the doctor. This is totally electronic control system, and at present this particular thing is manufactured more than 10,000 numbers and by the Bell and other TOT holders. And this particular thing, there was a further requirement projected by the Prime Minister's office. Now I will come to the decontamination. I already mentioned that the COVID-19 virus is spreading through the air. So if the air is sterilized, then certainly the infection level, you can reduce it. With that thing, we have started working with a UV-based sterilizer unit. And this UV-based sterilizer unit is working very well. Since this particular technology we have adopted in one of our underwater program for one of the submarines also. And this particular technology works very well here also. Now the limited series, this particular thing has got we have extra cautioned by adding certain viral filters also. You can see the blue color thing is the viral filters. Even that itself will remove more than 90% of the virus. And further, it will be any residual virus is there, that will be removed in the UV unit, which is, you can see it in the middle of this metal, this thing is the UV bulbs. So that will remove almost 99.99% of the virus will be removed actually, or decontaminated. So this particular thing we have already gone for the limited series production, and many of the DRDO labs and some of the hospitals, they are using this particular system. Now lot of manufacturing order has come for our TOT holder, and patents are also, we have filed the patents also, and this system is already in the submarine use. And this particular thing per minute, it purifies around 2.5 cubic meter of air. Next is the mask. Mask is now like our shirt. We have to, every day we have to wear a mask. So mask, it is expensive also. We cannot, reusability is difficult. So WHO advised for emergency purpose, you can reuse it, but after the proper decontamination. See, here we have developed a UV, since we are last more than 10 years, we are already experienced ourselves with respect to UV based decontamination. So we thought actually we can use the UV based decontamination system to decontaminate the mask, and we have already developed this system. LSP order was also completed, and in the DRDO level, this particular equipment is used as a various lab. So we can, every day we can decontaminate the mask up to, instead of one time use, we can use at least 5 to 6 times use without losing its properties. Next is we have made another attempt also with the help of another laboratory, that is MTRDC, that is very close to Bell Circle, and this is microwave based decontamination system. We have done the technology wise, it is good, but unfortunately the microwave will affect the fabric, actually particularly the fibers of the mask. So we have discontinued. Still we are working on discontinued time being, but still we are planning to take up further activity so that even the household level also we can, every house has got a microwave oven. We can make use of that facility to decontaminate and reuse the mask. Looks, since the third wave also coming, every now and then we cannot spend our money for the mask. Then we have set up some facilities also within our country. Most of the bacteria as well as viral filters are imported actually, and now some of the filters are from the last year. Some of the filters were manufactured in our country, and most of the filters actually we require the evaluation. In our small laboratory, we have set up a evaluation facility. We are certifying also now what type of filters a ventilator can use, what type of mask we can use it, and what is the efficiency of decontamination with respect to for reuse of the mask. Every facility we have set up in our laboratory. Similarly, this is some of the mask testing facility. We have innovated various technologies to test the various masks with respect to reusability actually, and many procedures we have developed actually, and it was appreciated, and the decontamination, many decontamination medium and solutions were developed by us. Similarly, hand sanitizer, it looks simple, but WHO has given the recommendation, and every sanitizer has to meet the WHO recommendation. We have innovated by adding certain herbal formulation we have added that will increase the efficacy of this particular hand sanitizer, and we have distributed many places, both state government as well as the central government organizations. I was talking about the detection technology, that for detection technology we require a special facility that is called BSL, that is Biosafety Laboratory. So we have established a Biosafety Laboratory last year. We have started testing RT-PCR mainly for the DRDO personnel also, and it is more than 1,000 numbers we have already tested. Certainly our positivity rate also very high. It is more than 22.2% as on today. I hope that importance of technologies for the various strategies which I have mentioned, like detection technology, protection technology, medical management technology, as well as the decontamination also. See, everywhere technology is a common factor. That is why I have chosen this topic on this very special day of National Technology Day. And I remember that Louis Pasteur, one of the quote, if it is a terrifying thought that life is at the mercy of the multiplication of these minute bodies, that is microbes, in the present scenario, it is a COVID-19. It is a consoling hope that science will not always remain powerless before such enemies. Governmental organizations, private organizations, public sector, academic institute, everybody join together to defeat COVID-19. Thank you very much once again for giving this opportunity.
Thank you very much, sir, for your very highly informative and enlightening talk about various technologies available and the role of DRDO that could help in managing the situation arose due to COVID-19. In your talk, we were able to understand very clearly the detection technology, protection technology and decontamination technology involved in handling the crisis due to the COVID-19. Thank you very much, sir. Now, we would like to take up some questions.
Okay.
Biswal, you can start questions.
Yeah, good afternoon, sir. It was so enlightening. You really covered all the technologies very well. I am especially interested in this air sterilization unit. So, is it available for purchase and can it be used in offices or in auditoriums? Is it a
Yes,
solution?
madam. Yes, madam. We have transferred the technology to one of the Bangalore vendor only, and one more vendor is there from Chennai. So I can give the Bangalore vendor address, madam, that it can be used in our lab also. We have used all our auditoriums, director's room. Similarly, all the director general's room, even our CV Raman isolation hospital, where the sampling place, there is a lot of threat actually. So it is used, madam. It is very cheap also. It is around 35 to 40,000 rupees only, but it gives a good, you will be happy with by buying that product actually.
Okay. That is,
I will
but
give
what
the address,
is the
madam. I will give the
capacity?
address,
What is the area one unit will cover for which? How much? What
Madam,
the area?
Normally, for the COVID-19 requirement, the number of air changes required per room is around 10.
Okay.
At least the minimum 6 is the mandatory, they tell. Means, yes, 6 times that it should purify it. Means a volume of the room is, you assume, 10 cubic meter. So per minute, it removes 2.5 cubic meter of air will be purified. Now you yourself can calculate it actually how many units are required, madam.
Yeah. Okay. Thank you. And
Thank you,
AC
sir.
can be switched on when it is used, or we should not switch on the AC.
Madam, this particular thing, madam, the first thing is the AC. Normally we avoid actually in this circumstance. The reason is AC is one of the place where it accumulates the COVID-19 virus. That is why if you see it, many places they tell avoid AC.
Okay.
So AC cleaning will be more difficult. Here everything is open only, madam. Only the air is passing through and the air is coming out. So
Okay.
there is no place actually it will accumulate actually with there is no other material is there to accumulate actually. So this thing cannot be connected. It is not desirable to connect with the AC.
Yeah. No, because generally for planetariums and theaters and all, no, everything, the area will be closed. It is designed like that, so that is the reason why I asked whether it.
Yes, madam. If it is a central AC system, then madam, the air handling units can be modified to suit this requirement. That can be done, madam.
Okay. Thank you.
Thank you, sir. Biswal, start question.
Yeah, there is a question from Mr. Shaju Bhaskaran, curator VITM. Already, sir, you have answered for that. Can the air sterilization units be used in places like auditorium or theaters? And how often are the filters used to be replaced or changed?
So this filter normally it is replaced for a month also. The thing is when the flow resistance increases due to the, suppose if you are putting this particular air sterilizer unit in a dusty environment, then the filter has to be removed. That can be easily decided based on the flow rate. If it is, if it is choked, then the flow rate will be reducing it actually. But flow rate, we are not put any flow rate monitor at this point of time. But you can make out also in a typical hospital atmosphere, we felt it can be used at least for 15 days continuously without any problem.
Okay, thank you, sir. Another question from Dr. YVS Lakshmi. Geolite is not available as we have to import. Can we substitute with any other material?
Sir, there are other materials are there actually, but that will not produce the requirement of medical grade oxygen. Means, for example, if a material produce around 85% of oxygen, as per the WHO norms, it cannot be used. That is why we are using only a specialized zeolites. Yes, the question is correct. At present, India is not producing it actually. So we are importing it only. Even for the, at present, there are 875 plants is order. That is double technology is used for manufacturing 875 medical oxygen plant. It is imported only. Still, work is going on. We have made an attempt with some of the premier institute, CSIR institute in our country, but we are not successful. The reason is, the industrial grade oxygen you can generate it actually with the indigenous material technology. But if you want to develop a medical grade product, then certainly quality become premium. So we have to import it only at this point of time.
Thank you, sir. Another question from Divya. Sir, what is your opinion about fatal black fungus development in patients having been treated with oxygen?
Sir, this particular thing actually we have recently come across. Actually, this particular in the normal operation theaters actually they test only for fungus and bacteria only, whether the suitability of operation theater. Similarly, here also that black fungus, whatever it was mentioned, it is also a deadly thing, and there are deaths also reported due to this fungus actually. But we have not made enough studies. At present, we are not by DRDO. The other premier institutes are working on this fungus.
Yes, sir. Another question from Mr. Vardhan Ramaya, Education Officer, VITM. Name and address of the supplier of air sterilization unit in Chennai.
Sir, I will be sending to them, sir. It is a big address, and I will send it to you, sir. I will send it to VITM, sir. You can pass it to them, sir.
Okay.
Biswal, next question.
Yes, sir. Question from Mr. Vishwanath, Education Officer, VITM. What is the difference between normal liquid oxygen and medical oxygen?
Sir, medical oxygen, it is a air, sir. Other one is a liquefied oxygen, actually. Means it is a liquefaction process, actually. In the air liquefaction process, all may be familiar, actually. So liquid oxygen is, the air is liquefied to get the oxygen. It's a liquid form. And that plants are also available in our country. Similarly, the air itself, like a PSA technology, like that we can separate the oxygen from air. So it is a air, and the other one is a liquid. The liquid also finally converted into air before it reaching the patient. And their requirements are different in terms of purity and other things as per the WHO standard.
Okay, sir. Next question from Mr. Gopal Krishna. What is the technology used in pulse oximeter and how it measures the oxygen concentration level in the human body?
So this is based on the photometric techniques actually. So both that how much oxygen is attached to the hemoglobin, then there will be a spectral change will be there. You can see the sensor will be there in the finger. That will distinguish it actually. If the oxygen is there, what will be the value? If the oxygen is not there, that is the thing. It is basically a photometric technique actually, sir.
Sir, another question. When human make oxygen in plants, medicinal plants, will it have an adverse effect on the environment? Since nowadays government and private organizations are making tens and thousands of tons of oxygen, whether it will have adverse effect on the environment?
But with respect to our atmosphere is concerned, it is very negligible actually. By concentrating oxygen from air, the oxygen concentration in the atmosphere will not change. So there would be big environmental change with respect to the oxygen concentration.
Sir, can the oxygen made in our labs or homes, like decomposing hydrogen peroxide, useful during emergencies if stored and kept ready?
Yeah, it is possible, but you see, handling hydrogen peroxide is very dangerous thing. The reason is, if it is hydrogen peroxide vapor is going into the respiratory tract, the permissible level for hydrogen peroxide is 1 ppm. That will give the more adverse effect than the shortage of oxygen problem. So it can be done. Hydrogen peroxide, from hydrogen peroxide oxygen generation is not a new thing. If you see the US patent, it was 1960s onwards, it is there. But there is a dangerous element also involved to handle it inside the house. But hydrogen peroxide used are in very, some of the places, defense use, we are using it hydrogen peroxide for oxygen generation, certain confined places.
Yes, sir. Another question from my side.
Yeah.
Just recently, I heard that DRDO, along with Dr. Reddy's laboratory, Hyderabad,
Yeah.
they have made a medicine for corona. That is 2-deoxy-D-glucose, 2DG.
2DG.
Yeah, 2DG. When actually, when it will be available for public? Like
Actually-
directly can buy from medicine store.
Yeah, this particular 2DG or 2-deoxy-glucose was developed as a part of nuclear, biological and chemical warfare program of DRDO. It has developed in fact 1915 itself. And the various trials was conducted actually. At that time, earlier studies were carried out with the help of Center for Cellular and Molecular Biology, Hyderabad. Afterwards, this particular thing was actually as a medicine formulation, our Reddy Labs helped Hyderabad. And now it has gone for various event class 3 trials also successfully completed. Very recently only we got a permission for the emergency use. Means any emergency is there, it can be used. But it will to come to the market as per the DRDO sources, it will take at least a month.
Yes, sir. Another question from Mr. Gopal Krishna, Education Officer, VITM. So DRDO anti-COVID oral drug works for all variant of corona.
Sir, kindly repeat your question, sir.
Sir, this drug which is recently got recently developed, that this 2DG, whether it works for all variant of coronavirus.
Sir, so far there was no drugs for corona, sir. That is the biggest problem we are facing it actually. So this will be only a support the breathing actually. That's all. It is not, kill the coronavirus inside the body. No drugs were developed in the world itself.
Sir, another question from Chandrasekhar Prasad, Education Officer, VITM. What is the artificial intelligence based software with X-ray to identify the normal lungs?
Pneumonia affected lung.
Yeah, pneumonia affected lungs or corona affected lungs.
Sir, this thing is for that pneumonia affected lungs as well as the lungs. Clear picture of the lungs can be done only through the CT scan. RT-PCR will tell the person is infected or not. That's all. That also from the swab. That also they are telling the efficiency of the RT-PCR test is only 80%. So the remaining 20% is we have to depend on CT scan only. So two things are different. Normally they combined the CT value of RT-PCR as well as the CT scan score. They will combine it to take a final decision by the physicians. So I feel, sir, maybe software can be developed to combine the both, sir, but two things are different.
So another question from Sridevi. In vitro diagnostic tests are in current use of identification of the virus, although they may or may not be 100% true. Can a more specified test which is specialized to identify the presence of the molecular structure of the virus be conducted, which makes it more reliable for people? Has there been any such attempt from India?
Sir, at present in India is using only RT-PCR, that is known as the golden standard actually as per the WHO. So the thing is, sir, other things, if you'll see the lot of startup companies in our countries also like FET-based system and so many other systems are coming, but none of the things were proven till now or it has come in the market. So I believe as on today, the golden standard is RT-PCR with respect to infection is concerned.
Last question from Divya. So what are the precautionary measures or preparation is being taken for third wave?
We have to continue to maintain that, put our mask properly. We have to wear the mask and we have to properly sanitize the mask. That is hand sanitizers. We have to regularly use it and social distancing. I think these are the three things from starting from our prime ministers to all the ministers and all the even school level also they are speaking. If you maintain it, I don't think third wave will not affect us.
Thank you very much, sir.
Thank you. Thank you.
Okay, I hope that there are no more questions, Biswal.
No, sir, in chat box, no more questions.
Okay. In that case, sir, we are very much thankful to you for answering the questions and creating awareness. And now I hope it is the time to propose vote of thanks on behalf of National Council of Science Museums and Vishweshwara Industrial Technological Museum, Bengaluru. Our heartiest thanks to you, sir, Dr. N.S. Kumar, Scientist G and Associate Director, Devel, DRDO, Bangalore, for sparing your valuable time to deliver the talk and interact with the participants and clearing many doubts among the many participants. Thank you very much, sir. Thank you all the participants for joining us in this webinar to celebrate National Technology Day. Thank you all present media for your support to us in organizing program. Our thanks to Srimati K. Sadhana, Director VITM, for our guidance and support in organizing the program. Thank you, Team VITM, for your support to organizing program. Thank you one and all as we have come to the end of the program. All the audience, I request them to kindly visit the website of the museum, www.vismuseum.co.in, to know more about upcoming programs. Do participate and learn science with edutainment. We are signing off. Thank you very much, everybody. Thank you.
Thank you very much, sir.
Sir,
Thank you very
one
much.
minute, sir. Dr. Reddy, YVS Lakshmi Reddy, sir, can you get the PPT? That's she has asked.
Sir, this PPT involves certain defense things, sir. We cannot able to share, sir. They can just certainly they can see it actually in the YouTube and other thing they can see it. I cannot personally share. That is a problem.
Thank you very much.
Okay. Thank you very much. Thank you very much.
Thank you. Thank you.
Thank you, Ananda.
Ele é